So HOST is a team that came together back about little over 3 years ago, in 2016. It's a collaborative effort between the Austin Police Department, Austin EMS, Integral Care, and the Downtown Austin Community Court. And it is a team of, it's a multidisciplinary team that works with individuals that are experiencing homelessness and actually work with them out on the streets, wherever they may be, to connect them with services that lead to housing, mental health care, medical health care, you name it, a bunch of different services. The goal is to get them into housing estimates. EMS serves the medical component of the team. Many of the individuals that we see out on the living out on the streets have medical issues, chronic medical conditions. So EMS brings the medical component, the medical navigation. Integral Care is the mental health component of the team. Many of the individuals that we see out on living out on the streets also have chronic mental illness, issues related to chronic mental illness, so they serve as that help. They also provide certain opportunities for housing. The Downtown Austin Community Court, they serve as a portal for patients to get into intensive case management. The community court has access to a variety of different housing and substance use and other different types of services. So many of our clients, many of the individuals that HOST serve benefit from those services. And the Austin Police Department, besides just providing security for team members that may be out there and encountering somebody for the first time, they also bring a wealth of knowledge and experience on issues related to the court system. So if they have issues with their ID, or if they have some, maybe some minor warrants or something like that, they know that system better than any of us. So they can help work through, and they know some of the different entities to work with to resolve some of those issues.
So we've started managing her medications, and she was running an extremely high blood pressure, and we got it down to a manageable amount. We also took her to get seen by a doctor last week for some trauma she sustained. So we were able to make a follow-up appointment by using our dispatch. We have one of our chips at dispatch, and they made a follow-up appointment. And I've been trying to talk to her about going to Community First Village, and it just so happened we have somebody from Downtown Austin Community Court here with us today, and she was able to make an appointment to start that application. Should be a perfect fit out there. Our main goal is to bring frontline services to our clients and remove all the barriers so that they can have the same medical and social equity that anybody else has. So making that connection and taking those barriers away is pretty much what we do every day. And that connection could be for any type of service. It's converting the crisis funds into non-crisis funds and using the appropriate resources.
And when I was talking to Ms. Beverly, I asked her, how long has she known y'all? And she just said that she's known you guys for about a year and that she just loves you guys.
We love her too. She's awesome. She's an example of who we work with, and they want those changes to be made. They just don't know how to navigate to them.
And that's why what you all are doing is so important.
Very true. And we have everybody on the team that can cover every single resource and intervention that needs to be done. That's what makes this team so unique.
It's the all-star team.
Agreed.